Good afternoon, everyone. Please come in and have a seat. Yeah. My name is Deloris Dockrey, and I'm with ICW North America. But I also work for Hyacinth AIDS Foundation. And my presentation today will focus on cross-training program staff on the intersection of HIV and intimate partner violence. Um, Women living with HIV experience violence in their homes. And oftentimes, in North America context that I live in, services are provided to the HIV positive person. And if you need services for violence, you have to go to a different entity. And what I am going to talk about is a model that will cross-train both HIV service providers and domestic violence service providers so that they can treat women holistically who comes to them with both issues of HIV and issues of violence in their home. So next slide, please. So basically, as I was saying, this is a curriculum that was developed by the National Network to End Domestic Violence. And the whole premise of the curriculum is that let's train HIV service providers to understand domestic violence issues. So that they can screen and so that they can better service women who are coming to them and be able to provide resources to help them. Similarly, women who are HIV positive who end up in shelters or end up in intimate partner violence services are able to screen and help women with HIV access services. So that's the purpose of this curriculum. It is a collaboration, it is innovative, and it trains both workers in both settings to work collaboratively to meet the needs of women. Next slide, please. So the collaborative agencies that I work with was Hyacinth, and there I am the trainer, and I was cross-trained on this curriculum to deliver service and to train others. Hyacinth AIDS Foundation really helps people live with HIV, works to slow the spread of the epidemic, and really serves as a critical voice in the community around HIV. My collaborator was the New Jersey Coalition on Battered Women. This is a statewide association of different shelters and agencies that provide intimate partner violence resources. And so, you know, we were trained collaboratively. The trainer from Hyacinth, which was myself, and the trainer from the New Jersey Coalition on Battered Women. And the reason for the training is to increase knowledge and understanding and the competency of people providing services to women with HIV and women who are victims of intimate partner violence. To really look at promising practices and to use those across the board, to build new partnerships so that we can treat women holistically, not just, you know, dealing with a specific issue, but seeing them as a whole. And definitely, we have to work towards reaching out beyond HIV and to look at the other issues that impact the lives of women. And so collaboration is the way to go, expanding collaboration. So let's understand what the problem is. In my context in the US, abuse against women and girls continues to increase. And their chances of becoming infected with HIV also increases. 20 to 50% of abused women have experienced forced sex. Women are 2 to 5 times more likely to contract HIV from men during sexual intercourse and vice versa. It is impossible to talk about HIV/AIDS without talking about domestic violence and domestic and sexual violence. Violence against women is not just a cause of the AIDS epidemic, it can also be a consequence of it. So the method that was used was to convene a trainer of trainers that both individuals from the HIV world and from the intimate partner agencies were trained together. And we used a specific curriculum that was developed by NNEDV on the intersection of HIV and intimate partner violence. It requires collaborative partners to develop training that will cross-train program staff in each of these agencies. And I'm so happy to say that Dazon is here. She's one of the developers of the curriculum. So once I've kind of gone through this slide, we'll have some discussion about the curriculum. Next slide, please. So, as I said, the two collaborating agency, myself from Hyacinth, I am also a woman living with HIV, 20 years. I work in the field, and we are best placed as peers to really address the issues of HIV and domestic violence in our setting. Leslie is from the New Jersey Coalition on Battered Women and really brought the perspective of the issues impacting women as it regards intimate partner violence. We completed the training together, and then we were tasked with training other members, which we have been doing successfully over the last year and a half. Thank you. Next slide, please. And again, this is primarily around the curriculum, which we think is a great model that can be used elsewhere. It allows people who are trained to enhance their understanding of intimate partner violence, domestic violence, they're one and the same, and to discuss the issues of power and control, and to understand the risk that impacts that domestic violence impacts survivors' decision-making as it relates to how they access resources and how they access services. And keep in mind, if you're HIV positive, this is a double whammy, because not only are you trying to seek services for intimate partner violence, but you're also trying to seek services for your HIV care. And when you're in that kind of setting, it is very difficult in your decision making. It impacts your adherence, it impacts your intent to seek medical care. So again, we really emphasize the understanding of the intersection between these two areas. Next slide, please. It is impossible. It is totally impossible to talk about HIV/AIDS without talking about the violence that women experience in their homes, or even the violence that they experience from their community and from their families. Next slide, please. Intimate partner violence occurs in intimate relationships. It's an intentional pattern of coercive act and behaviors to control the intimate partner. It includes sexual violence or intimate partner sexual violence as a tactic. Any sexual contact or activity with an intimate partner that makes you feel uncomfortable can be termed intimate partner violence. And it is the sole purpose is to control you through fear, threat, and violence. Now, I want to make it clear, violence is not only physical violence, but it's the full spectrum, and I'll go through that later. Next slide, please. So the takeaway message is domestic violence is a pattern of power and control. It's not about sex. Domestic violence is more than just physical abuse. It runs the spectrum. The intent of the abuser's action is purposeful, and it is to control their partner. And the decision around staying or leaving are extremely difficult for the victims. And that's why these services are needed. Next slide, please. I'm going to take a minute to just go over the basics of HIV and just really understanding it. And I do that because in the curriculum, it also briefly outlined an understanding of HIV. A lot of women, even though they're HIV positive, lack basic knowledge around HIV. And it is so important that whatever training is done, that you at least be able to convey the basic ideas around HIV. So the curriculum, if used, will increase knowledge of HIV transmission and the disease progression, prevention, risk reduction, and testing. And it will build an understanding of the intersection between domestic violence and HIV. You know, it talks about the 4 basic stages of HIV. It talks about the incubation period. This is when you're newly infected. It talks about the period which could last up to 10 years of no symptoms. And then, next slide, please. It goes into the later stages when you are symptomatic and when you start to show signs of the disease. And of course, the final stage of the disease is AIDS. And in the US context, it's when your CD4 count is below 200. I think it's the same definition in the WHO guidelines. Next slide, please. So the curriculum, and I won't go through that right now, will provide information on how HIV is transmitted, how you test for HIV, how it is medically managed, and the treatments that are available. Next slide, please. And so the takeaway message is any person who engage in unprotected sexual intercourse or share drugs work with an infected person is at risk for HIV. For most people, HIV is a chronic manageable disease. And of course, that's in the context of access to medication. Getting tested for HIV antibody as soon as one realizes they might be exposed is the best way to start managing the disease. So we definitely, in our context, encourage testing of HIV. Next slide, please. But I think that this is the crux of the matter, right? That they've been hit, and they've been hit with AIDS too, right? So I want to stop here for a moment, and I want to just have some dialogue with you all, and I would love to hear kind of what efforts are available where you are as women who are living with HIV and women who are experiencing domestic violence. What are some of the resources available where you are? Anybody would like to share?
Now, thank you so much, Deloris. I just wanted to just focus on the issues of intimate partner violence and like thinking on the African perspective. It is one thing when a woman is hit because of, like women experience violence in their normal setting. But also when now they become HIV positive, now it's no longer set to be intimate partner violence, but it's also termed as stigma. But so that connection of what happens, so there is violence that leads to HIV infection, but also now the data that shows what happens to this woman who is in this violence after they test positive is not so clear. But I also thought of the issue of evidence. There is no clear evidence to the extent of violence that leads to HIV infection. And probably if you have those numbers, it will be good to know.
And I think this is one of the deficiencies. While we collect data on HIV surveillance, there's not a lot of data that's collected around HIV and intimate partner violence. There's not a lot. There is some research being done around domestic violence and its impact, but looking at that intersection, I think there is more work. Dazon, do you want to add anything?
Will this reach? No, thanks, Deloris. That was fantastic. And congratulations on your partnering work. Hey, everybody, I'm Dazon, and I'm with Sister Love in Atlanta, Georgia, in the U.S., and in South Africa. And this, what I think is really important, which sometimes is the piece that gets missing, and it was even the challenge when we were actually putting the curriculum together, is that it seems to me, and I think that this might be a little provocative, but I have the same challenge in reproductive rights as well. For those of us who've been doing the HIV work for a long time, it's almost been, like we would say at home, a no-brainer to work at the intersections of issues like violence or around economic empowerment or policy, any of those other areas that are immediate and present whenever we're doing work with women in HIV. Not so much on the other side. You could spend a whole conference sometimes around violence and nobody ever talks about HIV. When we're even in training sessions around domestic violence, shelter workers, nobody ever talks about the HIV component. So this has been really, really important because when we put this together, it turns out that the HIV folks actually did have a lot more to learn and had a lot more attitudinal adjustment that needed to happen just in terms of how we recognize, how we help women find the resources, how we integrate the screening for violence in our testing and counseling, in our linkage to care programs and all of that. And on the other side, it has been a challenge, honestly, in working past the stigma, the discrimination, the still very present attitudes of folks who do domestic violence work and intimate partner violence work, but haven't done the HIV stuff. So getting past their own feelings about AIDS and about how not to discriminate in the safety areas or in the shelters, how to be able to help women understand what that stigma does and how that never crossed their minds and how to deal with that. And so this is a really, really, really powerful tool, not just because it increases and broadens the opportunities for services for the women that we're working with, but that it also creates a space for both camps, so to speak, to work more closely together, but to also work through their own stuff about each other's issues. And that, I think, was the best part of doing the training, of putting the curriculum together, is literally working past our own barriers, our own attitudes, our own prejudices, our own personal stuff around violence if we're in HIV and around HIV if we're in violence. And that it's a lot better when we're able to work together at that intersection. So I'll give an example. We have a shelter in Atlanta that was requiring folks to disclose, but never offered testing to people, right? So now they offer, if they don't have us there to do the testing, then they actually make it available for folks. Here, this is your day, this is where you need to go to get your testing, but also to get your other screenings, to get all of your health care. And by the way, make sure you get your HIV and STI screening done. Not that you have to disclose, but that you need to know your status, and then let us know how we can help. So those are kind of some of the things, and I will say also that we took that at my organization, took what we learned and integrated the power and control wheel and all of that into our HIV prevention interventions, which is called Healthy Love. You can find that online. But the Healthy Love intervention now has a whole violence component to it that we didn't have before.
Excellent, thank you. Sorry. One of the other examples is that in this training that we were cross-training, a lot of the shelters started to look at their policies, because one of the things they used to do is, or are they even still do it, they're trying to examine their policies that when women come into the shelters, they have to surrender their prescription drugs. And when they need to take their prescription drugs, they have to literally go to the counter and it be given to them. So this breaches all matter of confidentiality. And so there is like, can we look at how we do this to see if we can secure, if women can secure their own medication and take it when they need to take it without, revealing that they're on HIV meds. So there are a lot of policies in both settings, probably less in HIV, that don't take into consideration the needs of the HIV positive woman. Any more example where you are that you want to share? Oh yes, the curriculum is going live. So I'm going to try and see if I can get the website that you can go on, because it is something that you can adopt for wherever you are. It's a model that can be adopted. All right. Anybody would like to talk about where they are? Any the circumstances here?
I was just wondering, is the curriculum applicable just to specifically violence services, or for other people that would work with women who are facing violent situations? So
So the curriculum focuses on domestic violence or intimate partner violence. It doesn't run the spectrum of violence that is experienced by women. But what it does do is acknowledge that whoever provides services to a woman must understand the different dynamics, the dynamics of intimate partner violence or different violence that is experienced. The other training, in my setting, the other training that I've been doing a lot of work on is called trauma-informed care. And it is recognizing that decision making is often a result of your lived experiences. And so for a lot of women who experience early onset of trauma, it does impact their decision making as they go forward. So that is another curriculum, but because as an HIV positive woman working in the field, it is important for me to understand all the nuances and be able to help my community. I have taken the initiative to really understand these different curriculums so that I can train on them. But I hope that answers your question.
yeah, you've got services that are specifically for women experiencing intimate partner violence, but you've also got other services that those women will access, not necessarily for services for intimate partner violence, but they, in the screening process that will come up, are those people, those types of services on benefit? Yeah, I'm just trying to think. I don't know, general healthcare services, or if they go for an STI screening, or I'm thinking more broadly, I guess. Yeah.
So that's the purpose of the curriculum, right? So I work in an AIDS service organization where we focus on providing services around prevention of HIV, or we provide services around what a person living with HIV will need to stabilize them and keep them in care and keep them adherent to their medication. Or, so if we train our staff, when a woman, and we had a great example, after the training that I conducted with all our staff, a woman came in and she was a victim of domestic violence. Because of the training and the screening tools that we offer our caseworker, she was able to identify that and be able to direct that woman to services that we had then, told her about, resources that are available to her. So that's the purpose of it, is that you view the woman as a whole and that you try to connect her to services. Because what invariably happens is that the woman comes in, she has a bruise on her eyes. Nobody looks at it. They treat her for the HIV, give her what HIV services she needs, and send her home. But if those people were trained, then you could connect her, you could screen, you could get her consent, and you could direct her to other services that are there. So that's the purpose of this training. Yeah. Any other examples? Any other questions before I move on? Thank you. All right, next slide, please. Next slide, please. So let's talk a little bit about the statistics, and this again is in the North American context. Women who were beaten or dominated by their partners were more likely to become infected than women in non-violent relationships. These women who were beaten by their boyfriends or husband were 48% more likely to be infected. 24% of female patients experience physical abuse after disclosing their HIV status, and 45% fear such reaction. And the numbers again are in my context, but the reality is that this is it for women globally. And the numbers and the percentage might be even higher. Women who have a history about sexual and physical abuse by intimate partners are 2.7 times more likely to worry about acquiring HIV. Next slide, please. So I talked a lot about power and control, and if you work in intimate partner violence area, this wheel, this power and control wheel, is familiar to you. And the reason is the violence is like the visible part of intimate partner violence. And it is where most, if you're going to charge somebody with beating you up, this is where it happens. But in the life of women, that might be the end point of it. There are many other ways of being violent to a woman. It could be through coercion and threat. It could be, preventing her from accessing medical care that she needs to take care of her HIV. It could be psychological. It could be economic abuse, where you prevent her from working, or because you hold the purse string, she always have to negotiate money from you. Isolation. A lot of women who are abused, they're isolated, and if they have HIV, they're also isolated from their friends and family. It's around using their children, even saying that they'll take their children away from them, and using that to coerce and to control them. And it's about male dominance and male privileges. And I think that this translates in all, just across the board. So I took a minute to just go through this power and control wheel that really looks at the intersection of HIV and domestic violence. Next slide, please. So the takeaway message is there is a clear intersection between domestic violence, intimate partner violence, and HIV/AIDS. Intimate partner violence and HIV/AIDS program need to be prepared to deal with both issues in a knowledgeable and sensitive manner. Next slide, please. So, at the end of the day, our result was, we trained staff in both HIV and intimate partner violence. We increase skill and competency in screening, risk reduction, and safety planning. We initiate promising practice for service provision, and we learned about the benefit and key components of successful collaboration. I think collaboration is the key, and I think going forward, we really have to collaborate with just other things that are happening in women's lives so that we can help women to be empowered and to live a strong, a healthy life. Because we're not just HIV, we are many things. And as Dazon said, that intersection could be around economic justice, it could be around sexual reproductive health and rights, just many others. I am just focusing on intimate partner violence. And yeah, it's about identifying the best method of developing meaningful and sustainable partnership. In the program that I am involved with, we continue to do training, especially around screening tools for domestic violence. We continue that training. So the takeaway message is promising practice based on shared principles are effective strategies or action that can work within the unique context of each program, organization, and community. With knowledge, skill, and competency and practice, each of us can begin to institute and enhance promising changing practices. Develop and implement policies, procedures, and protocol for screening, handling disclosure, documenting domestic violence, and HIV is an example of instituting a promising practice. Community-based collaboration is a process that involves sharing information and resources to accomplish a shared vision. I personally think that we as women are holistic. We have a lot of issues impacting our life. And once we are able to build a system that addresses all our issues, it will allow us to be more empowered and to live stronger, better lives. And this is the start. Next slide, please. Definitely collaboration is a take-home message I want to bring from this. Because it helps to build a base of knowledge, it results in appropriate referrals, and it is a holistic approach to meet the client's need. And yes, it saves time and in many cases cost effective. Next slide, please. So again, I encourage you to learn more about this curriculum by going to the National Network to End Domestic Violence. You can learn more about my organization, Hyacinth AIDS Foundation, and again, New Jersey Coalition on Battered Women.
No worries. Also, the National Network to End Domestic Violence, the DWHIV is the email, but the website is also where the toolkit, which is called Positively Safe, is housed at the NNEDV website. And I'm not sure, I was trying to see in my emails where there should be webinars that they'll be posting coming forward in the near future, because it literally just went live on Monday. So there will be opportunities coming up in the few months to get the training, or at least the webinar for how to walk through the toolkit, coming soon.
And so for the rest of the time that we have, I would just like to have some just general discussion, either about your impression of this presentation and about this curriculum, or just any question around what's happening where you are and what are some of the services that might be available for women living with HIV who are also victims of intimate partner violence. Anybody? Okay, thank you so very. Did you have a question? No. Okay, thank you so very much.